Hello, I greatly appreciate you taking this time to listen to this presentation. So this is my proposal for what I'm calling an event-driven clinical information system, a design idea that I've had for a new electronic health record framework, if you will, given that our current systems have so many problems. So I wanted to start off with some of the premises for this proposal. First, that how clinicians understand and communicate about patients is as a story. And by that, I mean something very specific, a temporal and causal sequence of events. A typical such sequence might be a symptom developed, therefore a test was done, which gave an abnormal result, therefore a diagnosis was made, a treatment was started, and an outcome was achieved. These events are those that answer the common clinician question, what happened to this patient? And a hallmark of them is that they involve change. Symptoms, with or without attributes, starting or resolving, labs or imaging results being newly abnormal or improving from prior, the making of a new diagnosis, treatments like medications starting or stopping, or a change in regimen, in procedures that alter anatomy or disease, or also a change from what was intended, expected, or feared, such as an abnormality staying the same despite treatment to address it. So this story can take place entirely within one formal healthcare encounter, like an ED visit, or it can be spread across any number of encounters, an ED visit followed by an inpatient stay and multiple outpatient office visits, or it can even happen outside of these formal encounters, lab results coming back after an office visit followed by phone or other correspondence between a doctor, a pharmacy, and a patient. Similarly, in the inpatient setting, results coming back after rounds, followed by other changes in management. And in addition, multiple such stories can occur in parallel in the same patient. However, in our current systems, the most meaningful clinical information is in documents for which the goal is to produce one comprehensive text note for each encounter of all the data that was reviewed, elicited, or produced. But I'll posit that these encounters are only a means of handling, detecting, or performing these events and are not the most essential unit of clinical care in and of themselves. So I wanted to explore a design of a new type of clinical information system framework that's framed around these events rather than primarily around encounters that could clearly communicate what is going on with the patient, but still maintain what is necessary for multiple secondary uses of clinical data. So my proposal is that the product of data capture of clinical work within, outside, and across encounters is an event log. So a few words on the origins of this idea. I had taken some coursework in Java programming, which is described as an object-oriented programming language, and further coursework introduced me to event-driven programming, which is defined as a paradigm in which the flow of the program is determined by events. And this struck me as being remarkably similar to clinical practice, which is problem-oriented, and I'll posit that it is event-driven. Symptoms in their clinical setting and with their attributes determine tests, and results determine diagnoses, which determine treatments, which then determines further monitoring, which can include encounters. So I'd say that the flow of practice is determined by events, but our documentation and EHR usage practices are determined by encounters. And I think it is this discordance or this fundamental incongruence which is where some of the problems lie. Our current product of documentation primarily answers the question, what data did the clinician review? But we need a product that primarily answers the question, what happened to the patient? So I'm going to go through a few mock-ups of one possible interface for this kind of system of how documentation and capture could be done to meet multiple current purposes in a way that could be flexible, efficient, and useful, and look at a few different functionalities that I could see being a part of a system like this. I'll go over just a few settings, and these mock-ups were made with a free prototyping software, Pencil. So this is one way that a new patient, like a history and physical, could be done of a patient who's already in the system, but a new admission. Demographics here on the top, some navigation buttons here on the left, some reference and history information always visible here on the right. But then in this middle section, the actual history and physical, all the admission information in this encounter as one structured computerized form. But each element is a field in itself, and most of the task of documenting is comparing to a previous value. So one one field for chief complaint with free text for an HPI, review of systems and physical exam. The predominant task is to compare with prior and denote change or no change. Data that is already in the system entered by a nurse, like vital signs, you don't need to re-enter it into the system, but simply mark as reviewed, acknowledge that it was viewed, change or no change for a physical exam. But then if these encounters are regarded as a collection of multiple fields or multiple data types, this could be amenable to adding other data types like photos of physical exam findings, maybe even short videos or sound clips, or many other types of data that could be aggregated together as the encounter. Again, data that is already in the system, don't need to re-enter it, but just simply mark as reviewed, edit if needed, although I think patients could have some role in maintaining the accuracy of these types of data. Other data that is already in the system, like labs, don't need to re-enter it, but simply mark as reviewed. I have abnormal results in red. If there are other labs that need to be viewed or really considered to be part of this encounter, they can be searched for from this screen. Imaging results, one concise impression with maybe a modality to view a full report if needed, but again, just mark as reviewed rather than importing the text in. Assessment and plan, primarily just denoting change or no change from prior. One concise impression or new diagnosis with additional comments as needed. And then the plan, direct order entry itself right here with additional comments or other tasks that need to be done with adding more as needed. For ongoing problems, again, just denote change or no change from prior. Then after this is completed, all of those items that were addressed or reviewed or entered can be captured as a note and finalized in this permanent version, like a note, although I'm calling it an encounter summary. But the individual elements that have changed would populate here to this event log. And so this is just one version, one possible version, and I think this could really be the home screen, the first screen that is viewed upon entering a patient's record to see a sequence of changes through symptoms, tests, and treatments. So I have a few different icons for different types, signs or findings, labs, imaging, medications, this for diet and fluids, and other interventions, new diagnoses, future encounters, symptoms, and procedures. But then this could be a good modality for showing future planned encounters or reminders for future events. But this could also be a useful place for having an itemized plan to populate after the encounter is completed. Pending events or tasks that need to be done in the future could populate here. And if this were the case, this could potentially help with facilitating communication between doctors and nurses, for example, or multiple members of a care team. This is just to demonstrate that after a particular encounter is finalized and permanent, this event log could be edited. Individual events either removed, added, some reworded, to just always portray what is the most salient in clinical work. This is to demonstrate that for any individual event, you could have the option of viewing further detail about it. Here's one chief complaint with more details about an HPI. What I have shown here is an output that could be generated from a computer-based interview. A lot of the simple algorithmic questioning with yes, no, or multiple choice and short answer questions that could potentially be done by a computer with a doctor providing additional comments or additional nuances of the history. But further detail on a lab panel or a complete imaging report or an op report could be viewed directly from here. Then if there is the structure to these different events, this could be amenable to many different types of sorting or viewing capabilities here, showing both lab changes and medication changes to be able to see how lab results changed in response to medication changes. It's just one way of sorting them. But I think maybe one of the most useful ways would be to have the whole event log sorted by problem. And I think maybe this could be the default view, to have it just constantly shown as all changes, regardless of type, as they are associated with, or as they are associated by problem. And I think this could also be amenable to the preferred ICU format of sorting by organ system. So this is one way that an ED course could transpire. Again, a lot of the same border elements, but right here on the right panel, all of the tasks or items that need to be addressed here on the right side, but on the left side, the events as they are unfolding would populate here. Some new finding or a new event could appear in some modality like this as it is elicited in a platform that could allow for immediate order entry to capture what action is taken to address that. And then this could be automatically incorporated as part of the event log as well as the encounter. But similarly, outside of encounters in the inpatient setting or in outpatient, some new event in a new platform to just capture it as a new event with additional comments as needed, and then this could be where an order is written to take an action on it. And I think this could be one of the most useful features of a system like this, since it is really here between the development of a new problem and the initiation of an order that actual clinical decision making happens. This could provide a new platform for proactive ordering guidance of how a particular event, given the other structured data in the patient's record, what action should be taken on it. And this could be similar to other encounters, although I didn't demonstrate that explicitly in what I was doing with the HPI or the H&P, that there could be just more potential for clinical decision support with this greater structure to the individual components of the patient's record. But then those elements could then populate here to the event log in a seamless sequence with the rest of the patient's story, which is more like real life. And this sequence through a problem, its treatment, and its resolution were this was one of the desired viewing capabilities of EHRs, as was expressed in this opinion piece. And this type of sequence is what doctors recount when discussing what happened to a patient or what is going on with this patient. Then a long event log could be exported as a discharge summary, for example, in the inpatient setting. So I'd show that in here, just a few elements about the way I'm depicting this still. Abnormal results in red, improvement as blue, but a lot of these could automatically populate as phrases with verbs instead of just a very cryptic, short, like medication names, but actually including words like started or down with lab results. But also that I only demonstrated an encounter with a doctor, but I would envision that multiple provider types could have encounters that the changes that they detect would also populate here, as is the case in clinical care, that a nursing assessment is really when a change in vitals is first detected, and they would populate here as well. Additional comments on other usage. Any events reviewed section could be another section of an encounter summary, like in morning rounds, and included as a note if it's needed in a document form, which is similar to current practices, reviewing the last 24-hour events. But with this structure, there could be many ways to aggregate and view the data, but a system like this might possibly eliminate any need for the maintenance of systems external to an EHR, since there are many systems like spreadsheets or Word documents that people rigorously maintain with collections of baseline data, ongoing logs of major events, and tasks to be done in the future. But also a system like this would eliminate a need for copy and paste if the primary goal in documenting is to indicate what changed rather than what all was reviewed. And there's no need to have an ongoing log of a story in each progress note if an event log meets that information need. As far as efficient entry into the system itself, I think these systems could allow for entry by other staff. If any care encounter is really considered to be a care team encounter instead of an individual encounter, so that multiple people could be responsible for separate fields, one person doing the physical exam while another is entering it, or people could just share responsibility for different parts of the encounter, with maybe the attending of record just finalizing and verifying it when completed, but also allowing patient entry to review elements of their history. That could be a way to just ensure that it's more accurate, but also computer-based interviewing, as I had mentioned, for a lot of the algorithmic short answer questioning in the HPIs that could then be supplemented by MD comments, and also outpatient and inpatient portals for communication with the provider, which could be a means of adding events. Direct entry itself probably ideally uninterrupted keyboard usage with keyboard shortcuts I think would be a lot faster than having to interrupt that with mouse clicks, but also it could potentially be adaptable for a touchscreen mobile device for rapid inpatient rounds, computer-based interviewing, or for in resource-limited settings. So I do want to thank you for taking the time to listen to this. I do recognize that there are many issues that would need to be worked out, issues with design, functionalities, database structure, visualization, but I am saying that a design similar to what I'm showing in my mock-ups or something in line with my premises is worthy of further investigation as a clinical information system framework. And by that I mean based on events or changes, not primarily based on encounters, that any encounter is regarded as a collection of multiple data types and fields and not a just single text document to capture clinical actions like orders as a response rather than a standalone task, and that a home screen within a record would convey a patient's story. So thank you very much for your time.